All right. Well, good morning, everyone. I'm Russell Lupker from the Division of Epidemiology and Community Health at the University of Minnesota School of Public Health. And I'm fortunate to introduce the 19th Carl Martinson Lecture, an endowed lecture devoted to issues of health promotion and disease prevention. Next slide, please. Dr. Carl Martinson was born in Stillwater, Minnesota in 1888 to Swedish immigrant parents. He graduated from Union College in Omaha, Nebraska in 1913 and taught chemistry in high school and college for 9 years. While teaching in Chicago, he became acquainted with Dr. John Harvey Kellogg of Battle Creek, Michigan, and Cornflakes, who encouraged him to enter medicine. He went to Loma Linda Medical School, graduating in 1925, and was an intern at LA County Hospital. After that, he practiced medicine and surgery in Wayzata, Minnesota from 1927 over the next 40 years. There are several important characteristics in his career that go beyond these dates and numbers. Dr. Martinson, in his practice, stressed good health habits as a means to preventing disease, an important lesson today as it was then. From the beginning of his clinic in 1927, Dr. Martinson was smoke-free. It was not until 1985 that the university hospital became smoke-free. There are several members of the Martinson family on this Zoom meeting today, and we welcome them and thank them. Although we don't have our usual annual luncheon, we wanted to take this opportunity to briefly recognize 3 students who have been supported in their international studies by the Martinsons. Can we play the tape now?
Hi, my name is Richie Su, and I graduated from the MPH Epidemiology program back in 2020. While I was a student at the U, the Martinson Lupker Award allowed me to travel and conduct a research study in Guangzhou, China, related to sex education for men who identified as gay. I worked very closely with a local organization there with a strong history of serving the LGBT community. This was also a very valuable experience for me professionally to learn how to collaborate with community-based organizations and work at the local level to identify and develop strategies to improve public health. Currently, I'm still involved.
What happened, Jeff?
A research study in Guangzhou, China, related to sex education for men who identified as gay. I worked very closely with a local organization there with a strong history of serving the LGBT community. This was also a very valuable experience for me professionally to learn how to collaborate with community-based organizations and work at the local level to identify and develop strategies to improve public health. Currently, I'm still involved.
I am really sorry. This, of course, worked in practice several times. Let's skip to the next one. I'm sorry, I don't think it's going to work. I think we should just move on.
All right. Thank you, Jeff. There are 2 other students who had experiences in Africa and very good experiences. So let me turn it over to Dean Finnegan to introduce our Martinson lecturer for today. John?
Thank you, Russell, and good morning, everyone. You know, more than 300 years ago, the printing technology was spawning newspapers across Europe, and the Anglo-Irish satirist Jonathan Swift had this to say about the media of his day. The vilest writer has his readers, so the greatest liar has his believers. And it often happens that if a lie be believed only for an hour, it has done its work. Falsehood flies, and the truth comes limping after it. So, the topic that we're going to be discussing today is certainly not new in human experience by a long shot. But if falsehood flew in Jonathan Swift's day, in our time it has become hypersonic. Our speaker today is Dr. Tara Kirk. She's an assistant professor in the Department of Environmental Health and Engineering and a senior associate at the Johns Hopkins Center for Health Security at the Bloomberg School of Public Health. She earned her degrees at Stanford and her PhD at Hopkins, and she has expertise in human biology and anthropological science. Today, she conducts research to better understand the genesis and outcomes of large-scale health events such as disease outbreaks, bioterrorism, natural disasters, and so on. And health misinformation and disinformation are certainly a part of this complex. The goal of Tara's work is, of course, improving public health policy and practice to reduce their impacts on population and community health. Tara is going to speak for about 40 minutes, and then we will open for questions and discussion. And you can put your questions in the chat channel, and we will get to as many of them as we have time for. It is likely that we will go over our 11 a.m. stop, but if you are able to stay, we will certainly close by 11:15 this morning. And with that, ladies and gentlemen, please welcome Dr. Tara Kirk. Tara, the floor is yours.
Well, thank you so much for having me here today. I want to give a special thank you to the Martinson family and to the school for inviting me here. It's such an honor. And I'm so excited to be talking to you about a topic that I'm really passionate about. And I don't know if I should be happy or kind of down about the fact that the rest of the world is also really finding this to be an important topic these days. Mis and disinformation has really made a mark on our lives. And with the pandemic, we really see how it can change the course of a health emergency. So to get started, I wanted to sort of, Dean Finnegan really already spoke about this. This health-related misinformation problem is nothing new. It is an old problem with new wings. Here we have an example from Health in Pictures, a 1930s publication, showing a cartoon about misinformation and smallpox. Now, when I saw this cartoon, I really wanted it to be true, but it's always good to check to make sure that the things you really want to be true are true. This could have been made by someone recently and then said, someone could have said, oh, this was 1930. So how do we check those things? The first thing I did was do a fact check. So I looked at Snopes, and Snopes does have a fact check on it that does say it's true and actually provides the sources, and went back and did a close look. But other ways you can check for false information, you can use some of the web-based tools that are out there to assess source credibility. So NewsGuard is a good example there. Verify with other news sources or fact-checking sites like I did. Review the content from that source. If it seems like it's just one website with one person writing it, that's a questionable source. Don't use that. And these are actually tools that you can talk about with your friends and family when you're talking about mis and disinformation that they're getting. Let's go to the source first. Let's figure these things out. So these are tools that I'm trying to talk about that can be helpful to you. Be wary of these messages that are designed to appeal to emotions. Increase awareness of disinformation tactics. There are some there's some efforts that have been made to gamify disinformation tactics, so you can actually sort of play a game that teaches you all the tactics that people are trying to use to get you to click on their disinformation, and that can help you identify it yourself. And then understand your own personal biases and your capacity to change your opinion when presented with new evidence. Everyone thinks that the information they're getting, the information they believe is true, and that everyone else has mis and disinformation. It's important to consider, even for us in public health, to always be thoughtful about new information and how we might modify our beliefs based on new evidence. But before we get really into it, I just wanted to take a minute to sort of talk about definitions here. So misinformation, that's information that's false in the context of the scientific understanding of the time, noting that, science evolves, we understand new things. So this is in the context of the science of the time, and it's often the result of ignorance or poor understanding. Now, disinformation is different. It's purposefully created. It's, the person who's creating this knows it's false. They're disseminating it for a purpose. And so this is a lot more nefarious, I'll call it. And this can be created often has political, social, or financial motivations. But here we have our team divides misinformation into 4 different rumor types. Other people do different classifications, but this is how we do it. So we have, there's this large box here at the bottom, this yellow box, mischaracterizing the disease or protective measure. This can be, a lot of things fall into this bin, and a lot of things mix into other ones. But for this, it would be, for example, saying COVID's not real, or to say, these vaccines are going to get, they're going to inject you with a microchip. We also have false cures. We had the chlorine dioxide, silver solution, all these types of false cures that we saw early in the pandemic. We also see a lot of scapegoating. We saw a lot of anti-Asian harassment. Unfortunately, this headline was from June 2020, and I feel like we're still seeing a lot of that. And so that's another form of misinformation. But then we also see these conspiracies, a lot of accusations of profiteering. And actually, I have this picture here because I find it so interesting. We were looking in this Twitter data set, and we were looking for misinformation. And one of our analysts found a video of me. And this was actually, I co-led a large-scale pandemic exercise back in October 2019, focusing with a coronavirus as the pathogen of interest. We focused on 4 things: scarce medical resources, travel issues, economic impacts, and disinformation. And so there's a whole video of me talking about, in this scenario, how mis and disinformation is spreading and what governments are trying to do. And actually, this video was then used by people who were trying to spread mis and disinformation and say, we created COVID, that kind of thing, and it was actually used in its own misinformation. So it's very meta for me to see this. But you can see that we see a number of conspiracies, usually related to profiteering, but a lot of times also just like government related conspiracies. But I just want to say there is a long history of this, of these campaigns that have existed. We have, just a sample, but we have Operation Denver, the Russian disinformation campaign suggesting that the US had created HIV/AIDS. We, as public health people, we know also there was a disinformation campaign related to tobacco and its impacts. And we've recently seen pamphleting related to measles vaccination in ultra-Orthodox Jewish communities in New York. And that actually, that outbreak lasted a very long time and almost cost the US its measles elimination status. And then we saw it plenty with Ebola in the US. And I'm going to because this is an academic lecture, I do have a couple slides on a study we did here. We looked at Ebola tweets and misinformation. And I want to emphasize one thing that became very clear about this from this study, that we all think about mis and disinformation as something that's very obvious to us. Like, it's clear that that's false. And we actually, through this study, really came to the conclusion that there is that sort of low-hanging fruit of false information. Like here on the bottom left, this false information, like there's some sort of NSA whistleblower that Ebola is a staged event, obviously false. We also have obviously true information here, Texas patient, first case confirmed of Ebola. But we have this half-true information, or information that misrepresents the truth. So in fact, part of it is true, but it's twisted in a way that makes it not true. So here there's an Ebola patient in Fairfax County Hospital. I'm going to Canada. This is, so there was a person who was being evaluated for Ebola in Fairfax County Hospital, but this person did not have Ebola. And so, this is sort of something there that is a gray area, and that it makes it very difficult for people and social media companies to really determine what's true and what's not true. So when we did our evaluation of the 1% data set that we had, we saw that there were 5% of that data set was completely false, and another 5% of it was partially false. That makes 10% of the tweets we were looking at were misinformation. Is that a lot? Is that a little? I think it probably depends on what your social circle is and who you're connected to. Depending on who you're following on Twitter, you could be getting way more based on the fact that you're getting a non-representative sample. You're just pulling from this 10%. So I think it really depends on who you're connected to. So the other thing I just wanted to point out from this study is that early on, when we were doing this in like 2016 and 2017, we were kind of naive and thought, well, this is just going to be misinformation related to health issues. And that was just not the case. We saw a lot of tweets that were misinformation that were designed to promote discord or provoke a response, and often they were political in nature. So they were serving a political or social purpose in that misinformation that they were spreading. So here we have some examples. I'm not going to read them to you, but we just saw a mixture of them. And in fact, this discord thing, I want to point out this last bottom right tweet, GOP's worried about Ebola getting over the border. This hashtag is for TCOT and P2, and that's actually a very conservative and a liberal. TCOT is a conservative, or was a conservative hashtag. P2 at the time was a progressive hashtag. And so we see that this is sort of designed to get people to fight. And that's another thing going on with misinformation and disinformation in the US, that not just to push people to, not get vaccinated, but to fight over vaccinations. And, that kind of to widen the social and political divide that we have going on. So other interesting things from this study, just that we had most of this, we saw a lot of risk elevating messages. We saw a lot of government conspiracies. And like I mentioned, misinformation, we saw more promotion of discord, political risk increasing than the tweets without misinformation. But I think the thing that we all want to talk about here is, that gave us a lot of things to think about. And in fact, many of those misinformation tweets could be copied and pasted into what we see today. So we see now with COVID-19, plenty of mis and disinformation spreading, and it's really impacted the pandemic. Early in the pandemic, the WHO declared an infodemic, which is really here a rapid, large-scale spread of health information and misinformation through a variety of media and informational channels. And it's also here the overabundance of information. So some of it's true and some of it's not, but it's difficult for people to differentiate between that true and false information. They are just, overcome with all this information that's coming into a variety of different streams. And so they use mental shortcuts and also think and relate the information they're getting to their values and beliefs in what they choose to believe and what they choose to sort of move forward and make their decisions on. But what do we have going on in COVID-19? We have a collision of many factors, right? We have a novel virus. The information about it is limited at the beginning, and we have emerging information, and that information changes as we learn more. That's a very difficult situation by itself for mis and disinformation. But we also have a few medical countermeasures initially, so there's a lot of fear. We have an expansive social, political, economic dimensions of the pandemic, right? It affected everyone, everything everyone was doing. When we started a Twitter analysis here, and we were just like, well, we just have so many tweets, we can't how do we even sort of pare it down? Because there was nothing else to talk about for a while, and it affected every part of everyone's lives. So we also had this social unrest and division, expanding access and ability to provide content, so you can get whatever content you want, and you can also make your own content. And then we also have a large and monetized media market, so people can make a lot of money off of these things. And then we have declines in science and digital literacy. So we have kind of a worst case scenario, I feel like, here. And I want to sort of emphasize and talk about a very brief study that our team did, led by Richard Bruins, who are our economists. You know, a lot of people, I think, originally thought, well, mis and disinformation are just words, right? They're not going to hurt me. But you know, we have really realized it's not just, these are sticks and stones, right? These are things that will actually make a difference in the pandemic response and cost us. So we did a quick analysis. This was based on, you know, what are the how many people are not getting vaccinated because of the misinformation they're receiving. Now, those metrics are very hard to find, and we had to sort of do a rough estimate with a wide confidence interval. But if those, you know, if between 5 and 20% of people are, you know, who are not vaccinated are doing that because they're getting misinformation, and you know, that seems like a low number, because if you think it's just 5%, why are there 95% not getting vaccinated? But still, we wanted to be conservative just in case. It's still $50 to $300 million a day that we're losing for productivity, deaths, hospital costs. And so if we were able to sort of reduce or counter that misinformation, and we're able to sort of in that way reduce non-vaccination by 10%, that would be worth $50 to $30 million per day. So there is a huge economic incentive to do something here, because this is a problem that's big. And unfortunately, I think it's something that will not just go away. So another picture of myself. I'm sorry, I kind of feel like a little vain here, but I wanted to include it here because we're talking about policy change. This was some testimony that I gave. You can see, kind of get the heebie-jeebies here because no one's wearing a mask and everyone's close together. This was some congressional testimony in March 2020, before the world really changed. And you know, the things that I think that we really need to be doing here, the policy change that we need to be seeing, we need to see a national strategy to combat health-related mis and disinformation. And I specify health-related because there's a bigger problem when it comes to you know, elections and all those other things, but I think that we can bound it in a way that is manageable when we think about health-related. You know, I think we need to be including social behavioral concepts in technology development. You know, I don't know if I mentioned this earlier, but we build technologies and expect people to just go with them. If we develop the technology, people will come and people will accept it. And we know that that's just not the case. And I think in public health, this is something that public health has been aware of for a long time, but that you know, you need to talk about these social behavioral components of a technology uptake, rather than just saying, well, I built you a vaccine, now you can just take it. We also need to be thinking ahead and think about, can we anticipate health-related misinformation and disinformation and plan ahead for it? And then also just investing in public health communication. I think a lot of times, you know, I did a study, I think it was back in 2016 or 2017, and we were interviewing health department communicators, and a lot of them would just say, it's just me. I am doing 5 jobs here and it's just me. So there's not the investment in, you know, having the bodies in the seats in public health departments to do good communication and to manage mis and disinformation. You know, we can't have one person trying to do it all. And we need to invest in the workforce and in, you know, growing that workforce. But I want to go into one specific sort of thing that we worked on that I think is really important. You know, getting that national strategy moving forward. That this is not something that I think that we can sort of do in a whack-a-mole kind of style. I think we do need a national strategy, just like we needed a national strategy, a national biodefense strategy. And I've organized this into 4 different pillars. The first one here is controlling misleading content and sources. So here, you know, we need to say, we want to prevent all that, as much bad stuff from getting out as we can. We know that we can't do everything and we can't be perfect about that. But, you know, we prioritize it as a national security issue. We create a national commission to create guidelines and recommendations. And here, I want to say this is more of a non-governmental effort here on the National Commission, just because I feel like it's very tricky to have government deciding what's true and what's not. It seems like it's not transparent enough, and you can see how it would erode trust in some populations, and then you'd be right back where you started. The other thing here is to obviously encourage active, transparent intervention from social media companies and news media companies. But I just want to emphasize that I don't think that social media fixes are a sufficient fix. I think that we need to do more than just have social media, again, determine what's true and what's not true, and try to hold back mis and disinformation. I think that's a limited and not complete solution. The next pillar here is to promote factual information. For here, we really need to prioritize public health risk communication, like I mentioned before, and increase coordination between public health experts and sources of public information. So, for example, your school could be really working, and probably is working, very closely with local news media organizations, social media, to try to sort of promote this good public health information from a more neutral source. And when I say neutral source, I mean many people don't trust CDC. So what other sources can we provide them that they might trust? The third pillar here is to increase public resilience. And this is something that I think schools of public health are actually really well suited to do. This is something that I think has been been part of how public health schools have really worked to reduce smoking, to do seatbelts, these types of things, trying to create a norm, a public norm about digital literacy and health literacy. Schools, community organizations, social media, news media, to sort of safeguard this and promote it, and also to improve resources for public verification of questionable content. So those fact-checking sites that I mentioned earlier, and other digital tools to vet sources. Not only do you need to have them, but you need to get people to use them. It's a two-step process. That's not just, I don't want to assume that that's easy. And then the final pillar here is a collaboration of all stakeholders. So, I was mentioning before, I don't think this is something that government solves by itself. I don't think it's something that social media solves by itself. I think it's a multi-sector thing where we bring in social media, news media, government, national security officials, public health, scientists, and the public. I think we all need to take a hard look in the mirror when it comes to this issue. And then also coordination across the government. When you look at this, you see a lot of people in DOD and HHS working on this. You see Homeland Security and intelligence agencies working on it, but you don't see them communicating. Sometimes when I talk to folks on the, more on the DOD or intelligence side, we're both working on the same thing, but we're not speaking the same language. And so I think that there needs to be more coordination that's going on there. Some legislative efforts have happened. So some of you might be familiar with the Section 230 legislation that Senators Klobuchar and Lujan put out. This would hold social media companies liable for harmful health-related misinformation, but that misinformation would be determined by HHS. And so there are some concerns there about transparency. Representative Swalwell actually in July did end up putting forward some legislation for national strategy to combat biodefense misinformation. I don't know if that's going to go anywhere. His staffer who was pushing that ended up going to a different committee, so we'll see. And then, there's been, I think, actually more effective local legislation declaring misinformation a public health emergency. So we saw this in San Diego County, and then working on it in Sacramento County, Monterey County. It was in the California State Assembly. This follows the Surgeon General's report on misinformation. And I think, if we can't get real movement on this at a national level, I think, local level is a good way to go. But I wanted to talk just at the sort of, as I, draw to the end of my presentation here, I wanted to talk about, what can you do when you're dealing with people who believe false information. And in fact, I think probably everyone on this webinar has tried to do this and probably been really frustrated by it and I will just say that I have a lot of sympathy. I've tried it. I've had it happen. And sometimes you succeed and sometimes you fail. And sometimes the best you can do is keep the conversation open for next time. So, the most important thing here is to start by engaging respectfully. I think very few people, are willing to take the next step in the conversation if you're like, you're an idiot. Even if you think that, we got to start off with respect and, that you really care about that person. Connecting on values. What are those shared values? Because a lot of mis and disinformation is really resonating with people because it resonates with their values. And the other information that they're receiving that is truthful information, contradicting their misinformation, they don't agree as much with the values that underpin that. And so we got to figure out what values we can connect on and move forward from there. We can talk about tactics, right? How misinformation is designed to draw you in. What about it is appealing to you, and why, or to the person you're talking to, and why that is sort of drawing people in. How is that appealing? Talk about alternative explanations. What are the other reasons why this misinformation, or this information that they're getting, the evidence they're seeing, what are some other explanations for it? Talking about verification, what sources could be used to verify that are trustworthy sources, or fact check it. And this is actually a very tricky thing. This moves into the next step, which is to provide true information and alternative information sources. Because of how the pandemic has been politicized, and how trust has really been eroded in science and public health, it's tricky to find alternative information sources that someone who believes misinformation will find credible. So sending them to the CDC or the WHO is probably not the best idea. Local public health districts, especially when these are people who are part of the community, those are good sources. Local news, schools of public health, I think, can be good. These are good alternative news source or information sources, but you have to really talk to the person about what they would believe. And sometimes, I will admit, you have to say, am I going to be able to convince this person? And if you can't, you just need to sort of protect yourself and move on, because you can't, not everyone is convincible. Now, this is a different thing. If you come across false information online, so this is like on Twitter or on Facebook. So the most important thing to do is don't retweet it with this is wrong because blah, blah, blah. You can while you can refer to the comments, don't, you might have 5,000 or 6,000 followers. And now that you've retweeted it, you've extended the reach of that person's lie. So, you can say these vaccines don't have microchips because blah, 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 but don't retweet that. I used to say, don't actually even talk about the myth, but it's just so hard to effectively, refer to it in a way that gets people to understand what you're talking about if you don't actually talk about it at all. So I think just don't retweet it, don't promote it. The other thing you can do, you want to do is, if you don't know the source, or the source is not a legitimate, limit your direct engagement. So I wouldn't DM that person. I wouldn't spend my time trying to go back and forth in a discussion, because as you do that, you're just giving more energy to this person or this lie. So be cautious there. Report it to social media companies and focus on providing true information. Some things that I think that we really need to work on here, that I think have either gone in the wrong direction during the pandemic, or things that have been neglected, are maintaining and building trust. So working with trusted members of the community, and also being transparent when you're collecting data, you're sharing it, you're providing information on why you're making different decisions and what values you're making those decisions on. That also comes to engaging with identity, right? Those values, core beliefs, affiliations, listening to what the concerns are and what personal priorities they relate to. So someone whose business is closed down by the pandemic is hurting in a way that makes them much more vulnerable to misinformation that says the pandemic isn't real, because they don't want to believe it's real, because it's really hurting them in a variety of different ways. So I think it's important to listen to those things, and have some empathy for people. And the other thing is to communicate uncertainty well. So that means to foreshadow change, identify what's known and unknown, and what's been done to fill those gaps. I think that this is a huge thing that could have gone better with public health, especially early in the pandemic. I wish that when I was talking about masks, I'd talk about them a little bit differently. And so I think that, this is something where we need to talk about, things that we're sure about and things that we're not sure about, and why those reasons are. So some future efforts here, thinking about how do we have anticipatory pre-bunking and debunking, this long road to rebuilding public trust in public health. I think we need to recognize that has really eroded, and that we've got to fix it. It's not going to be fixed by ignoring it. And I think it's certainly become a big problem. And then we also just need that policy that reflects the needs of today. It has to be transparent. We need clear definitions of mis and disinformation, and also needs to be restrained. Even though this is a big problem, it's not something to just go at, without sort of some thoughtfulness, because I think it's easy to go wrong here. So I just wanted to take a minute here to thank the misinformation research team. Here in the middle, we have Richard Bruns. He is our center economist and has taken an interest in these topics. So he ran that economic analysis. We also have Divya Hosengadi and Mark Trottershad, who are senior analysts at our center and working on this topic. Annie Sundelson is my doctoral student, is starting work. And then John Rossford is a research assistant who's starting to work on this topic. So that's all I've got for you today. I'm actually going to stop my share so that we can see each other.
All right. Well, Tara, thank you so much. That was a good presentation. And as you can imagine, we have a ton of questions that are coming from all over the place. So I'm going to start with some of the more recent ones, and then we'll work our way back. And I also want to thank Dr. Wynn, because she's been keeping track of all the questions as well. So whatever I miss, she'll be able to jump in as well. So one of our members of our audience asks this. X says, excellent presentation. Do you have suggestions for effective messaging, in particular addressing paid caregivers who are strongly anti-vaccine? For this group, facts appear largely irrelevant. We are producing peer-to-peer PSAs and using the Ad Council's message of "it's up to you," recognizing our country's pride and individualism. Are there other ideas to nudge people toward getting vaccinated?
Yeah, so Jerry, thank you so much for that question. I think he's actually, he mentions, that these PSAs recognize our country's pride and individualism. And that is, that point of engaging with identity. And that's really important. I think, I actually did a very small study that we're just writing up right now, talking with home healthcare providers. And so this might be the group that you're talking about. But for them, many of them said that they were motivated because their clients asked them to, or they were worried about getting their clients sick, or they really wanted to be able to, they really cared about someone who they were worried about getting sick. And so that was one justification for them. Another one was that, they didn't want to miss out on work. And this was actually a double-edged sword, because they didn't want to miss out on work. So they getting vaccinated would help them, but they were worried about missing out on work because they were, down a day or two from the side effects of the vaccine. And so I think sort of managing those expectations, I think, is an important thing there. But, other caregivers and the agencies that we talked to also mentioned they gave economic incentives. They said, you have time off for this vaccine, or I'm going to pay you $300. And so those other things, they can help. Someone who is strongly anti-vaccine, the people who is at the far end of the spectrum, people who are on the far end of the spectrum, those are really hard people to reach. And I think the important thing is to sort of reduce the influence they have on other people who might be sort of middle ground.
Thanks a lot. I'm getting a lot of questions really about that relate to how do we bridge to communities, rural America, for example, and other communities that are very distrustful
Right.
of government, that are distrustful of political opposition and so forth. How do we bridge those? Are there websites, as far as you know, or resource centers that could be very useful for us to help do that? I mean, the point is, how do we bridge these discussions? I don't know that we'll obviously totally solve everybody's misinformation issues, but how do we bridge those at a community level? You talked about a policy, a larger policy, a national policy, and in a country like this, how do we implement something like that?
Well, I think that the larger policy is addressing it as an issue, but not necessarily telling people what's true or not. And so bridging these issues of trust, I think this is a critical question and so important, especially when we have, such a divided situation. I think that the most important thing is to build allies. And I think that this has been this has been part of community or public health for a long time, right? That we need to build allies in these communities, people who are already trusted in the communities, and who can provide this information. But I think that there's a limit to, I think Dr. Fauci is great, but he's not going to convince another person in rural America to go get a vaccine. And so I think that it needs to be other communicators who are already trusted in those communities who make those arguments. I mean, one thing I want to point to is that a Coursera course just came out. One of my colleagues at the School of Public Health has been working on it. A Coursera course just came out from Hopkins talking about how to talk to parents about vaccinating their kids. And this is another big area, not just, a group of, kids are another big group, not just, the Republicans and rural America who need to be vaccinated, but also kids. And so, for this group, it's talking to their parents and getting them to trust. Many of them may already be vaccinated, but how do we talk to parents? And so there's a Coursera course on that. It's a couple hours, and I think it could be helpful both for, public health folks like us, but also, school districts or other people in the community who want to talk about it. And that's really sort of the same thing, bridging to people in the community who are trusted, who want to talk about it. How do we give those tools to them?
So one of our viewers here has this idea. This is Sarah, and she says this: I think highlighting early intervention with respect to education is important too. For example, implementing cyber civics curricula for all 6th to 8th graders in an effort to make future generations a little less susceptible to mis and disinformation. What do you think?
I think that's a great idea. In some cases, those efforts are already underway. If you, a lot of high school courses, classes will talk about how do you find a good source and those types of things. But I mean, I do agree, cyber, like specifically on this topic, could be helpful. But I also want to highlight that that would be a longer term solution. Right now, we have a problem not just with young people, but also older folks in their 60s, 50s, 60s, 70s who are on Facebook and sharing, false information. Everyone has a family member who's sending you random things on Facebook that aren't true. These are this is also a group that needs to be educated, and this can happen through AARP, and actually AARP did try to do some work here, or senior centers or others, to help people who didn't grow up with computers or social media navigate that information landscape.
Thanks. I want to acknowledge a really good observation by Jerry, one of our participants today, and it makes the comment about changing media systems in the country. Says this: so many small town newspapers had to go out of business, and of course local newspapers in rural America were really a source of valued and trusted information. And she says the costs and reduced populations just made it impossible for them to continue. Local editors were helpful in keeping to the truth. there's a key point in here because media systems are totally dominated these days by transnational firms, Facebook and a whole bunch of other things as well. And of course, small town newspapers have really suffered greatly, which is, I think, another example for folks that live in those communities of a loss of agency, a loss of power, if you will, in many respects.
Yeah, I was actually meeting with a small town newspaper reporter yesterday for coffee, and we were kind of bemoaning this trend. But I think that there's actually something we can all do in this, and that is buy a subscription to your local small town newspaper, read it, follow the reporters on Twitter, and give them your support, because we've shifted to where people need to be able to. We can't change the economics of it. You just have to be able to support these newspapers so that they can actually operate. Information, it seems like we expect free information, and maybe we do have to pay for people to provide good information.
One comment that keeps coming up in a lot of the questions being asked here has to do with the role of the CDC, and here's a good example of that. Aaron writes, how can we have functional national policy when we can't even get the CDC to put out reasonable messages promoting public health? I'm feeling depressed.
Yeah, I work closely with some folks at CDC for a couple of my projects, and I have a lot of sympathy for them. Also having to be in CDC clearance review for 8 months. These things are just, anything that comes out is just tortured to death before it makes it out. I do think, though, that public health, CDC, public health agencies, and public health, people who opine on public health, need to sort of recognize that public health is not public health values aren't the only values out there. And so we need to sort of say, the thing that Aaron said, like reasonable messages. I think that that's the important thing. We need to have these policies be accessible to people who have, different sort of values and approaches. But the problem is that makes it then a lot of times not intellectually pure. And I think that's an expectation problem, because we have competing priorities. And so we have to sort of accept that, policies aren't going to be perfect. And I think that's a tough expectation to put on CDC.
Yeah, there's also a lot of questions about, how do we deal with media or other, channels that purposely put misinformation or disinformation out there. There's even a website out there in the UK and the US, I think it's called the something against digital hate. And one of the things that they did, as you may recall, is that they called out the disinformation dozen recently. In other words, they went into the social media and they found 12 individuals, at least in the English-speaking world, that are primarily responsible for a lion's share, over half of the disinformation that's out there. And the New York Times started to do features on who these people are and what their motives are and all this kind of stuff. Is that really contributing or just driving a bigger wedge across the country?
Well, so I have a lot of respect. The person who leads that group is Imran Ahmed, and I end up on a lot of talks with him. And he does some really good work. And I love that he is sort of takes a big stick to social media companies. There needs to be that person out there. And I do think that the people they've identified are serious problems, but I don't think that they generate the problem, right? This is feeding a narrative that already exists. And if you took those people out, I think the narrative would still continue. And so I think, we need to think more deeply about what the solutions are. And how can we sort of fix the system?
Yeah, Hillary asks this, and this is where individuals are in tough spots. As someone with a chronic illness who also has a child under 1, I've struggled immensely with how my circles have responded to rapidly evolving information during the pandemic. Any tips on how to best push forward new and good information while continuing to remind people that everything we know about COVID is extremely young information that, while true today, will almost certainly change as we learn more, and that's and that is okay. You know, that's a really very good point, because I do find among some folks myself that there's a sense of, well, yeah, but you're people in public health, you're always changing your mind on stuff. Well, that's also the nature of science. And, you know, in 100 years, we have never had a virus like this. I dare say it's even different from influenza in the sense that its extreme ability to mutate is something that I don't think we even saw with the 1918 influenza per se. But she raises a very, very good point about a little bit of humility, perhaps, in public health in the way that we message that, hey, we don't know everything today, it's going to change. Would you agree with that?
Yeah, I mean, that humility, I think, is probably the most important thing. I saw a shirt that said, "Trust me, I'm an epidemiologist," and I was like, I mean, yeah, but I think that just saying that I'm an expert, so you should believe everything I have to say, I just feel like a little bit, that worries me. I think we should have some humility and say, this is what this is the information that we found now, and this is what it means right now, but it could change. I think she also brings up a good comment also about different risks and also different risk tolerances. And so, I think that, just saying this is a risk that I'm dealing with because of these things. I'd like, it would be good for you, to help me out by doing X, X, and X. I think that can be really helpful, especially with parents with young kids. Having a support system that's vaccinated so they can help you if you get sick is really important. So, I think that there's a variety of different things going on in that question, but the humility part of it is certainly is very important.
You know, we've had several questions also that relate to the foreign source of disinformation. In other words, disinformation that is coming from perhaps the country's adversaries outside that are meant to really stir up our own challenges in this country, the issues that we face with respect to race, the issues that we face with respect to partisanship and so forth. Is there a way to identify sources of that? I mean, do we have folks that are tracing that back to their source, wherever that may be in the world?
Well, this isn't really my expertise, but I've seen other people who work on this talk about it. And I do believe that there are people who can trace certain rumors back to different groups. And there is a foreign piece to this, more of a classified piece to this. And I certainly think that, there was a paper that came out in AJPH a while back. It was about Russian trolls. And it, really emphasized that, we see disinformation out there that's not necessarily designed to get people to not vaccinate. It's designed to just widen this gap, to drive a wedge more deeply into our population over whatever the issue of the day. And that's why we see so much misinformation, I think, around COVID-19, because it is the issue of the day. And it is not necessarily that the misinformation is focused on the COVID itself, but the COVID piece of it is the vehicle for the misinformation, to give it more legs, to give it more eyes, to cause it to do more damage. And so I think that this is something that, has unfortunately worked, with the division that we see in the country. I think it has driven it deeper.
So Natasha, one of our alums, says this, UMN alum here who has been studying misinformation as a passion project since undergrad. Are there any countries that are doing a better job than we are in the US when it comes to mis or disinformation?
Well, the European Union and the UK have started to address this as an issue, a focus issue, and so I think that they've started to get moving on it. It's hard to compare different countries because we have different values. We greatly value individualism, freedom of speech. These things are, central to us as Americans. And so I think that, just taking a solution from another country and plopping it on top of the US is not really I feel awkward about that. But one of the research analysts on our team, she did a sort of across a bunch of different countries analysis of different things that different countries were doing to address mis and disinformation. And some of it was good, but I will say the other dark side of this is that some of these programs are used, they don't have clear definitions on what mis and disinformation is, or they are, kind of very flexible. And all of a sudden they're used to control, speech from political opponents or social groups that are, minorities. And all of a sudden now we've got a big problem. So, I think that, I take other countries' efforts against misinformation with a little bit of a grain of salt.
So one of our epidemiologists says, the phrase, "trust me, I'm an epidemiologist," is in response to others who are claiming expertise in the area, like, "Trust me, I'm a basketball player," "Trust me, I'm a quiz show host," or whatever it may be.
Sure.
Really, it's the issue about undermining, who are you going to trust? I mean, really, the basketball player is a good person to trust? Well, anyway.
That's a fair point.
Yeah, I'm going to ask Ruby Wynn, who's been monitoring the conversations, if she's got another cluster of questions that maybe she could pose to you. So, Ruby?
We do. This comes from Jason. He's particularly interested in your comments about political affiliation. So he's wondering if misinformation or disinformation sources are more or less effective according to political affiliation. So for example, are left-leaning misinformation or disinformation campaigns on anti-vaccination more or less effective than perhaps right-leaning campaigns such as those against firearm safety?
I don't know the answer to that question. And that would be a really interesting research question if someone's doing their doctoral research. But I would point you to, there are some analyses out there that look at bias and bias, and also and how left leaning it is. So it actually, if you look at different sources, it'll be kind of like a boomerang shape. And in the middle is sort of like AP and Reuters or whatever. And then it kind of goes down, and there's left side and there's right side. And so, it acknowledges that it's on both sides. I don't know which one's more effective, although I would say, those right-leaning sources have an incredible audience, and an an audience that is doesn't have heterogeneous news selection, and so it's a bit of an echo chamber. So I do feel like some right-leaning news sources have really pushed some bad narratives when it comes to public health, but I don't know, I can't compare how effective they are.
Dr. Sell, you've grown an incredible amount of research interest among our audience. So Maddie's interested in learning more about your methodologies, specifically the Twitterverse. It's a wild and sometimes crazy place. So when you talk about your work looking at tweets and analyzing tweets, for example, as non-jokes or jokes or sarcasm or not sarcastic, what measures do you use? How do you go about that?
Yeah, so that was difficult because we, and so I think someone's looking at my paper. Thank you for the for the access or the download count. So we start with a 1%. We work with folks who've been collecting the 1% Twitter data, so the random Twitter data set. And for the Ebola group tweets, we could just pull from a time period that anything mentioned Ebola. We can't do that for COVID because it's just way too much. We're hand coding these, which makes it so that we can take a look at things like sarcasm and jokes, and at least have a human eye where we have like 2 or 3 people evaluating, is this really a joke and is this sarcastic? Because a computer can't tell if it's sarcastic. And that's something that's important to determine when you're trying to figure out what's someone saying with this tweet. So we had 2 coders. We did an initial sort of document review where we ran some kappas on our coding, and then they went off and did their coding individually. But if anyone had a question, you just marked it for a question, and we discussed it, all 3 of us together, because you know, it's really easy to sort of, if you're not part of that conversation, to sort of not understand what's going on. So you had to look into, we had discussed it, and we spent way too much time on these tiny tweets trying to figure out what was going on. So that's just a sort of, in a nutshell, what we were working on.
And so, Dean, I just want to end with one comment that summarizes many questions. Dr. Sell, there is a fair amount of skepticism for moving forward with the national plan, given the hiccups and flat out fails that we have had in public health nationally, not just CDC, but also, as you mentioned, coming from Dr. Fauci, maybe even the White House, the White Houses over this period of time. So if you'd like, please comment on that, why you think national strategy would work better than what we've been doing so far. And then secondly, maybe who you would enlist to help with this national strategy. People who we have not previously enlisted.
Sure. Yeah. I mean, I think that, you know, I am a little bit uncertain about large government solutions as well. I see this as government being part of having almost more of a convening function and a planning function, but not necessarily determining what's true or what's not true, and really sort of bringing together the key stakeholders to have a voice in this. So I think it's social media, like I mentioned. You know, I think it's academia. I think it's bringing people from schools of public health and other organizations together. You know, and bioethics and all these other groups. I don't think, and I want to emphasize this, I don't think that, you know, a government's going to fix everything approach is the way to do this. Just because I think that we have so much distrust. This needs to be really transparent. And so, you know, I think it's pushing forward an idea that we need to start planning around this and have a response, because if we don't have a unified response, then we're just going to continue to limp along and fail like we have thus far.
Wow, well said. I think I'm speaking very much on behalf of our audience today. This has just been a terrific presentation, and at the risk of embarrassing you, Tara, that medal that people see in back of you is actually an Olympic silver medal that you have won as a competitive swimmer for a number of years. And I believe that was for the breaststroke, and it was at the Athens Olympics years ago. And there's a little secret people don't know about you on this thing. So thank you for representing the United States in that and doing so well. So I'm going to hand things back to Russell if you want to close us out. And I do so much appreciate all the questions. We did try to group them. Sorry we couldn't get them to all of them individually, but clearly this is going to need more than one seminar.
Well, thank you, John, and thank you, Tara, for an excellent presentation. I want to thank all of you who helped pull this together. The Martinson lecture has had a high standard, and you certainly have not let us down today, Dr. Sell. And I finally want to thank the attendees, and particularly the Martinsons, who have supported this and supported the University of Minnesota over the years. So for everyone, take this home and think about it, and be well.
Thank you.
Bye-bye.
Bye.
So much.